So now I just want to move on to talking more about testifying. And I think some of you mentioned about building relationships with your Senate or assemblyman. And I think that's really important. I've never testified, but I had a really good relationship with my senator. And he, like, I'll give you an example when we had that overdose. What was it? The Overdose Prevention Act. I met with him and I simply explained to him that Narcan for overdose patients is like AEDs for heart attack patients. And he was like, I get it. Okay. And then he would come to me. Once you have that relationship, they come to you to ask you questions. And I learned from him too. He would say, all right, I know you're for it, Sue. Who's against it and why? But I think framing our issue when we're testifying is really important. So maybe tell us about more detail about your experience testifying, how you frame the issue, and that sort of thing.
I'll start here. I feel when you are trying to get a bill across, I think you really have to look more, not the reason why. It's kind of like a hypothesis. You want to test it out and figure out what's happening. So I think when it comes to full practice authority in New Jersey, you have to really look at, what are the issues? And historically, this bill has been right now it's S19838944, and historically, it was very contentious among physician versus nurse practitioner slash APN. And when I came on board, say it now and I'll say it then. I am not going to go against my physician colleagues. I will not put another person in my profession because we all work as a team to provide access to care. Now, what I've done with legislators when I meet with them, physicians are great. They're experts in the field. There are not enough of them. There are 10 million New Jerseyans and there's X amount of providers. There's not enough of them. NJCC put out a great report on, districts, modalities. Not only just businessmen sit on these Senate and assemblies, but attorneys do. Lawyers are very fine tooth and comb in reading your bill. They look at everything, possible avenues. They have special counsels like the Democratic Tim Lyons, who's now with Mikey Sherrill on her team. He's the attorney, was the attorney advisor for Democrats. You want to make sure that you are able to pitch this to them to ensure safety. So you have to really make sure that your bill could be controversial. You definitely can have controversy in your bill, but what is the message and why does the other side oppose it? And you want to hear their points. There are concerns about safety, there are concerns about education, but not one study out there will tell someone how much time does make one deem competent. There's not one study out there that will tell how many hours one needs in practicum to make them a competent provider. So when we look at that, we have to really look at the model of what we are as providers and what we're doing. So what I've done is I've shifted my focus in saying there's not enough of them. There's an access to care issue. These residents are not getting slots now because of what's happening in the federal level. There's a shortage. There's going to be more of a predicted shortage. There's more New Jerseyans coming into New Jersey. We want to make sure that we pitch that. And when I testified, the resident physicians were not very kind. They did say a little contentious stuff. And I said, you know what? My residents spoke from the heart. Again, my residents who had a holiday party, I covered them. One of them had, one of our ENT surgeons did a tracheostomy, and the residents packed it with like a bunch of gauze because the patient was bleeding instead of using like a clot stopper like Surgicel or something. And what happened was the patient developed a clot and that was obstructing the airway. It was not the correct dressing to use at that time, but I caught it and I spoke to an attending surgeon and I was able to do that without any collaboration, without any, and that's the key. You work together and you push that across. You don't make it contentious. And historically, this bill was very contentious. And there was a physician, you will find this very often. There was a physician who was chair of that committee. And if you kind of think about it, it's a conflict of interest, right? But you don't want to be contentious. You want to be politically correct. You want to know your homework, what their concerns are. Physicians are great. There's just not enough of them.
Thank you.
That's a great point. And so you made a great point. And somebody asked earlier about bills skipping committees. And I agree with Jean. That's the exception to the rule. It's very rare. But it brings up a good point that it's not just testifying here in Trenton. It's not just coming from committees. You can legislators and their staffs in their district offices and talk to them well before Phil ever sees a committee hearing. And often that's the time when amendments can be made. That's the time when legislators and their staff have an opportunity to learn from you about what the bill really means and what impact it might actually have. And they want to hear from you. They don't want to hear as much from me. So I'm going to be paid to do this. They want to hear from people who actually do this. So a lot of times I'm trying to bring physicians, nurses, people who are actually doing the work in front of these committee hearings to testify because you can tell them exactly how this will impact your career, your future work, your patients. So I would say doing your homework for sure. That's a huge, huge thing. You definitely don't want to be untrue when you come in front of a legislator. You can definitely say, I've done this many times. I'm not sure. I'll get back to you. If you're not sure of an answer, that's completely acceptable. And as Jean mentioned earlier, you can say, I'll get back to you through the chair. And through the chairman, you will distribute information after the fact. And then just being genuine. I think that's really a huge part of coming here and getting respect and credibility is being yourself. People want to see people who come here for the right reasons, who have passion about the issue that you're testifying about, and really just being exactly who you are, becoming a parent, not giving a canned speech. I would say that's really important. If you're nervous, people have a tendency to read what they've written. I would try not to do that as best you can. Legislators definitely do not want to hear an hour-long speech and give you 2 minutes. They will ring a bell. They will tell you to step away. So just write a note card of a couple of bullet points and say, this is why I'm here. If you can give some anecdotes and some personal stories, that's even better. But just speak from heart. I'd say that's perfectly there. Basta, second-ish.
Thank you. And just another little nugget of information to give you about testifying. I do a lot of reading on second bills, and when New Jersey passed the bill that nurses could pronounce in any setting, I read about that in other states, and one state said it didn't pass because a patient's family spoke about an adverse event. So to me, that illustrates the nurses need to be there explaining this legislation and the rationale for it. And, sometimes it's those adverse events of one person that prevent that from being so testifying for all of us, we all had valid nursing experiences is really important. So anyway, so take away the stage. Tell us that.
Okay. Um, I knew my case supplement from my congressional district. And then also in my work with the Nurses Association at state level, the State Nurses Association and the State School Nurses Association, we have very close relationships with two senators, Senator Ruiz and Senator Vocal. And they have been just wonderful supporters of us, but they have educated us in the legislative process. They've kind of walked us through. Yeah, we're a small association, but we're a passionate school. There's a lot of us throughout the state, so we have many members, and we are always looking for opportunities to advocate for our school communities and our towns. So I'd like to give an example of one that just happened. That we came to our attention through our legislative team that there was a bill that would propose LPNs could work as the sole school nurse in a school, and there would be a requirement to have one certified school nurse per district. So you had some districts where there's like 50 schools, and then you have some that have 3 schools, right? So it's very different, and every district is unique. But really, it came down to when we found out about this bill, legislative team brought it to the executive board, and just with the wording of the bill, no one could testify yet. So it's in that phase, I guess, that you mentioned, where you actually testify. And so we were very early on in the process. We heard about this, so we reached out to Senator Couple immediately, and we had a meeting with him. He said, well, you have to tell me why this is not. So we talked about scope of practice. We looped in the Board of Nursing. We were able to, it's hard to reach the, executive director of the Board of Nursing, but we kept at it, and then also having Senator Bocal's name on this, email for Trump reach her definitely helped. So that goes to like the history that we had a relationship, an ongoing relationship with him. And then, and Senator Ruiz heard what we were doing, she also supported us. So this was actually, I don't know, like, I don't know what you would call it, but it was basically because the whole bill collapsed. Hill had signed it, right? He killed it. So I think that was an example of something, where I don't know if it was Marcellus, but where if you act quickly, sometimes I guess you can be rocky and the ahead of the process before people start testifying. So it was killed before it even got to that point. And that was huge for us, right? Not just for school nurses, but for nurses throughout New Jersey, right? We want to protect our practice and we want to, of course, ensure public safety. And the Board of Nursing, as soon as they called it, they were very supportive of us. But I do think that having had a senator really helped us tremendously. She would have listened to us as nurses, but we were able to see her quickly because we had, a legislator, involved.
Another great saying. Thank you very much. And Hill illustrates the importance of relationships with the Senate, with senators and assemblymen, but also joining your professional organizations. That is so important. So, do we have time for student questions?
Does anybody in the audience want to come up and ask a question? All right. I just have one question. Are there any issues that you're actively like advocating for now? That's
Yeah, so I'm actually advocating for full practice authority. We have it's bipartisan support. We have over 40. So in order to pass a bill, which you let me be, that is 80 assembly members, over 40%, 40, which is over 50%, 41, which is over 50% have to support the bill, and then the Senate, 21, which is over 50% have to support the bill. And right now we have those numbers in both the Assembly and the Senate. We worked really hard. We also now have American Academy of Nurse Practitioners. It's not a local organization, it's a national one that actually got involved because they saw our traction and they're helping us and they've dedicated financial support to give us a lobbyist in addition to NJSNA that has a lobbyist and now our society has a lobbyist. And I know the Hospital Association also is really much in support of our bill. So there's a lot of advocacy going on. We have a few individuals who are in power who, have concerns of the bill because of the physician community. But again, you basically speak from the heart, you say what you want to say, and then you get it across. And hopefully during our lame duck session, which is what we're making on, we're gonna hopefully get this bill after all these years.
one last question. Um, how can we like as new nurses, like once we graduate, can we start to get a go in like the state of policy advocacy? Tools.
I think somebody said it before, getting involved in your professional associations is super important because they have a lot of resources dedicated to tracking bills every day. And there are thousands of bills that get introduced every year. Many of them never make it across the finish line or even close. But there's a lot of ideas out there. So knowing about all the ideas and filtering down into the ones that are actually important, the ones that will actually get done, that's really the role of a professional association. You can certainly do some digging on your own as well. The New Jersey Legislature has their own website. That's where all of the testimony is. Sort of repository of all the live testimony. You can actually listen to it live as well. You can look at the schedule of committee hearings. So I think Jean said earlier, there's going to be a whole cadre of committee hearings after the election. So typically the legislature won't come back until after a major election. So after November 4th, they will come back. There will be a whole schedule of committee hearings. I would say if this is something you're interested in or think you might be interested in, check out those schedules, see when the committee hearings are happening. Typically for nurses, you're going to be most interested in the health committees, the human services committees, and the regulated profession committee, because that's really going to be where all the nursing bills go. So I would check out a committee hearing. You can come here in person and see what it's all about. You can meet people here, and you can also listen to it live on the New Jersey Legislature website. So I think there's a whole host of ways to get involved, but I would say you can do anything from being passive and listening and learning to being more active. And when you get involved in a professional society, they might ask you to come and testify. They might say, "Do you want to participate, Bill? And would you be available?" Here, if you have a passion for this, say yes. Just say yes. Come and do it. If you do it once, you'll do it again, and then you'll get practice, and you'll feel like you're really contributing and making a difference. So, there's a ton of ways to get involved, but just say yes.
Thank you.
I'd like to add, can I try to that? I think as a nurse, especially since you're starting for your own, some of you may have been nurses and then you're going back to in graduate school. But I really personally think that joining the State Nurses Association is an excellent way to get started. They have a legislative team. They have, because it's the state, there's meetings all over the state, there's dinners, it's great networking opportunities for you to meet the president in your region. I think that it's just a great way to kind of just get your feet wet. And if you are interested in a legislative piece, they're at the meetings they always discuss legislation. Always. I mean, I've never been in a meeting.
Yeah, I'd agree 100%. That's how I became this legislative junkie. That it was through New Jersey State Nurses Association and involvement in Congress on policy and practice. And people think you're experts in the bills, but sadly, it's because the bills are around for a long time. They don't pass. I wish they would, but like protect the title nurse, that's been around, the full practice authority. So you get to know the bills really well, and it's fun. But the other thing I'll say is on our New Jersey Collaborating Center website, we have the current bills that would be of interest to nurses under the policy tab. So you can look there for more information.
Thank you so much.
Can I just add real quick? I think everyone in the room needs to get involved. I think this is something that you should get involved in related to your profession. There's only one nurse in the whole legislative process in New Jersey. If you look at Pennsylvania, they have about 4 or 5. And there's some of the nurse practitioners, some are nurses. You need to advocate for your profession. If the nursing community comes together and you take the numbers of how many nurses there are in the state, and I'm talking about from RN, Associate GW, BSN, MSN, quarter mil, a lot. And you have a lot of power. And that's how what they call organized medicine. We can have organized nursing. And we need to move in that direction to get some of the bills passed because they don't get heard. There's not a lot of voices because people who are advocating for these bills are not in the trenches, but you all will be. And that's what you have to speak to. There was a nursing scribe bill that was put out and that was killed, quote unquote, killed. What is a nursing scribe? What do we need this for? The fields with AI. So you have to really advocate for the right thing for your profession. And I think everyone needs to get involved. And I agree, joining the State Nursing Association, various organizations nationally, get involved. Don't just, oh, why is this going on? Why does this happen? Laws and regulation dictate your practice in your hospitals, in your clinics, etc. So please get involved.
Thank you.
So college nursing experience GP is appropriate to have before you start testifying.
I don't think it's just nursing experience. That's my answer. I think it's everything that you bring to it. If you're a mom, you have kids, and there's problems like vaccines, bring that to the table. If you come from another state and you have practice issues, for example, nurse practitioners, we are categories in yellow for signing death certificates. If you look at the bill, sure, nurse practitioner can sign a death certificate. However, only when the physician nor the resident is not around, right? So here's a potential scenario. The doctor went to McDonald's and technically he's around. He's just on break and you signed the death certificate. Where is that? How is that law going to protect you? Which is something that we're advocating for. We constantly advocate for adding the language of nurse practitioner, and a lot of these also work with the PA community to any bill that's introduced. The loan repayment, they state physicians, not nurse practitioners, for mental health providers provide access to care in homeless shelters. The APN language was not included here. We asked that to be amended in the bill. You have to look at the bills and you have to be on top of them. But your experience, not just as a nurse, but as a human being, and providing that knowledge that you come with can do a lot of good for the community.
I would say as a student too. I think student experience, and you're, part of our state's university, coming and testifying about your experience as a student and what it means to want to be a nursing student, to want to pursue a nursing career. That's huge in terms of our workforce. We need to have a pipeline of nurses that want to work in this profession for their entire life. So your experience as a student is very valuable as well.
And just using that bill about protect the title nurse, that only an RN, APN, and LPN can use that if that bill ever passes. And you as a student can be, I've worked hard going to school. I feel like those who don't have those titles shouldn't be calling themselves nurses. So, I think that hopefully is a good example. Do we answer your question?
Could I just add one more quickly?
It's kind of tacking on with what Tyler said. Take advantage of every opportunity that you have now while you're a student. You know, we had I run Girls Along. I mean, I went to the Hill today when that was off. I mean, we did when there are different, opportunities available to you, take advantage of them, because it's hard once you start your career to maybe take the time off, right? But aside from the time, it just gives you that experience, and then also the professors are just tremendous mentors. I mean, I didn't even mention how much they inspired me. When I was in my graduate program at Rutgers, I just admired them and looked up to them. And that's why I went ahead and participated in the different, activities that were offered to us. So really get involved in the life of the university. It's a great university, huge, right? It's the flagship university. And I think, you'll all be very proud Rutgers graduates like I am one day.
All right. Well, thank you. We hope we demystified the process of testifying for everyone and that you'll consider testifying.